I was working full-time as a dental hygienist. I was 22, making $80,000. And at the time, it seemed like, yes, I had hit the jackpot. And now I'm a first-year medical student. Hi, YouTube. Welcome back to my channel. Don't forget to subscribe and leave a comment or like if you like this video. So let's get right into it. So this video is about why I decided to go to medical school after working as a dental hygienist. I am a registered dental hygienist. I've been one for 6 years. I'm certified in nitrous oxide sedation and local anesthesia infiltration as well. And in 2008, I moved to New York City to attend New York University, otherwise known as NYU. And there I majored in dental hygiene. So I got my bachelor's in dental hygiene. And at that time, I was also taking pre-dental, pre-med courses because I had intended on going to dental school. So I graduated in 2011. About a week after graduation, I took my dental hygiene boards. I passed. So 2 months after I graduated, I took my dental admissions test. And my plan was to go to dental school. I applied, I did not get in. But during that time, I was also looking for jobs as a dental hygienist, and I had plans on retaking my dental admissions test because I started full-time work. That didn't happen, but then I had this epiphany while working, probably about a year and a half in as working full-time as a dental hygienist. I realized that I actually didn't want to go to dental school. And the thing is, I really, really love dental hygiene. So at this time, it was 2012. I was working full time as a dental hygienist. I was the lead hygienist in the office. I was 22, making $80,000. And at the time, it seemed like, yes, I had hit the jackpot. But there was something in me that actually just wanted more. Um, I figured that dentistry just wasn't the career that I saw myself ending up in. I love dental hygiene, but I knew that I did not want to become a dentist. So, a dental hygienist is an allied health professional who specializes in prevention and maintenance of oral health. So, as a dental hygienist, my duty was to remove hardened deposits of plaque bacteria, also known as calculus, from the teeth as well as the gums. And also, if there was a patient that had active gum disease, I can apply antibiotics under the gum to kill that bacteria under there. I can also apply preventative sealants on top of adult teeth of children to prevent cavities. We take x-rays, and we're not allowed to diagnose as a dental hygienist, but we can alert the dentist if we see something that may be suspicious of a cavity. Patient education is a vital part of the dental hygiene care plan. So in patient education, we show the patient how to better take care of their teeth, how to floss, and we also educate them on how their oral health can affect them overall. And we also let them know that it's not just having plaque on your teeth. This is bacteria, and your mouth is a part of your body. So making sure that you have a clean mouth ensures that you have a body that is rid of bacteria or any other microorganisms that could potentially harm you. So the office where I worked was located in a rural town of about like 3,000 people. This was located in Brewster, New York, and my office was a family practice office. So I really enjoyed treating the whole family, from the children to the mother, father, and even the grandparents. So that was a really interesting experience for me. And in my office, we were a private practice, but we also accepted state-funded insurance. And I would say about 3/4 of our patients were on the state-funded insurance. So my patient demographic was highly diverse. And so it was just a really good experience to learn how to treat patients of all walks of life, all different socioeconomic statuses, and it gave me so much experience as a new dental hygienist. So in about 4 years of working as a dental hygienist, I had treated about 12,000 or more patients. And that is a lot of patient care. So I have had a lot of hands-on experience with treating patients and just seeing how promoting healthcare and preventative health is really, really vital. So in my practice, I would encounter many patients with moderate to severe gum disease. So it was pretty life-changing to see a patient come in with bleeding gums that was very puffy and just a lot of edema, and their teeth were just in really bad shape. And I would give them a cleaning. I'd give them a deep cleaning, and after that, I'd show them how to floss, and I'd tell them that, this is bacteria, so I'm removing it now, but it's up to you to continue this treatment at home. Like, I can do my part here, but if you're not continuing your care at home, you can go back to that state that you had when you came into the office. So I was able to see patients change their attitudes towards their dental health, and that was really amazing to see that I could actually influence that behavior in a patient. And I would also see patients who would come in with multiple cavities or have some teeth that were hypocalcified, so there was like less calcium in their teeth, and that was making them more prone to getting cavities. So with that, I would tell them to maybe follow up with their physician and maybe see if there's any nutritional deficiencies that they may be having. Also, I even had a patient who actually found out that she had a deficiency in parathyroid hormone, and that possibly was contributing to her teeth being hypocalcified and weakened, and having that weakened enamel. So it was very interesting to see that the oral health was correlated to one's overall health. While I was at NYU, I was a part of a study that showed the correlation between gum disease and diabetes, and we were trying to develop a novel approach of screening for diabetes, like chairside at the dental office, because most patients with gum disease do have bleeding gums. So we would take the blood samples chairside, and we'd also just compare their finger stick blood samples and see if those readings were really close. From personal experience, I've had patients who honestly came to see me for cleanings more than they actually went to see their own doctor. I've had patients who said they haven't seen a doctor in 10 years, but they were in my chair every 3 or every 6 months. So it was basically a way to increase access to care and kind of get patients back into their primary care doctors. That was a pretty interesting research experience, and I would share that research experience with my patients, and I tell them that yes, one doesn't cause the other, but they're highly correlated. And basically, a patient who had poor control of their gum disease would also have poor control of their diabetes. So I'd share that, and I've even had a cardiologist recommend that their patient get cleanings more frequently so that their oral bacteria would be reduced and in turn reduce any bacteria that may be present in their patient. And I've advocated with insurance companies to cover the deep cleanings that they were denying of certain patients. And I've even had patients, if their insurance wasn't covering, they knew that it was something that they truly needed in order to improve their health, and so they invested in their health. So it's just really about empowering the patient and educating the patient. Patients respect you, and if you advise them well enough and you advise them appropriately, they will make changes in their attitudes and their behaviors toward healthcare. So I got really invested in doing these investigations of these oral manifestations that could be connected to something that was happening systemically. And I started doing more research, and I got really, really invested in this. And I started to research a profession that would allow me to treat the patient comprehensively, like something that where I could use this investigative knowledge and something that was evidence-based and something that obviously would be beyond the scope of the oral cavity because I wanted to treat the whole body at that time. So I stumbled upon osteopathic medicine, and that's when I learned that there was these principles of treating the whole body, and that really aligns with the ideals that I had newly had this epiphany with. And I realized that, yes, I did love to be a dental hygienist, but I realized that becoming a dentist was definitely not something that I wanted to do. I wanted to be a preventative care agent. I wanted to be someone who had the autonomy to actually advise patients on their overall health rather than being confined to the restraints of the oral cavity. And I just love this like research nature, this investigative nature, and that actually drew me to becoming a medical student. And now I'm a first year medical student. And I am so happy that I became a dental hygienist because it led me to my ultimate career destiny. And now I'm here and I'm enjoying the journey. And I'm forever grateful to the profession of dental hygiene because I don't think I would have landed myself in medical school had it not been for me becoming a dental hygienist and seeing these patients and having that experience. And it's definitely helped me and definitely will help me as I progress in my career in the medical profession. So I hope this inspires you to go after whatever it is that you feel you're driven to achieve or accomplish. It's never too late to go back to school. Like, yes, I thought that I would be a dental hygienist or become a dentist, but that changed and I'm totally fine with that. And I have no problem going back to school after having already started a career. And it's never too late to do something that you feel so impassioned about. So I hope this inspires you. And if you like this video, please give me a like, comment your thoughts, and don't forget to subscribe. And I will see you guys in my next video. Bye.